might be an option to actually test their performance in the actual situation because it may be a detriment to their safety or to the safety of the system. And so we bring them into the virtual reality cave is because it provides us with a way to immerse them in an environment that replicates what they would have in their actual environment. It allows us to do that safely, and it also allows us to modify system factors or environmental factors with a lot of flexibility and with a lot of ease. We are actually simulating the patient telemetry monitoring station at Washington Hospital Center, and basically what these telemetry stations serve as is taking the most critical patients in the hospital who might need constant 24-hour monitoring, and there are operators who are assigned to these patients around the clock. So you can actually have an operator who has up to 64 patients that they have to monitor at one time, and they sit and they watch screens. And they do this for several hours. And they're monitoring things like heart rate and pulse oximetry signals. And when there is an adverse event, the operator then has to respond. So virtual reality is very immersive. And you also are allowed basically a constant, you're allowed to present stimuli to the participant in a constant manner, one which you might not be able to replicate if you were to do a mock-up. So we would then present them over a period of about an hour with different scenarios, with different alerting patient alerts. We also have surround sound to replicate what you might find in an actual telemetry room with the chaos of things that might be beeping in front of you, beside you, behind you, and some alarms that are not even intended for you to respond to as an operator. So we try to replicate both audio and visual stimuli as they would actually be seen in the environment. And then we look at the neurophysiological indicators and determine which ones are best to actually detect stress and cognitive load.